Shore of Sydney. And tonight we're going to talk about blepharoplasty, eyelid surgery and facelifts. So first of all, I'd like to thank Trish for the opportunity to speak this evening. And if there are any questions that anybody has while we're talking, feel free to write them on the Facebook Live chat forum, and then I'll endeavour to answer them as we go through. So there are quite a number of questions that have already been sent through, but first of all, I'd just like to quickly tell you a little bit more about myself. So as I said, I'm a plastic surgeon who practices on the North Shore of Sydney. I've been a plastic surgeon for 20 years now, and I'm well experienced. I've performed over 18,000 plastic surgery operations. I'm fairly conservative. Again, that goes with the area that I practice in. I tend to specialise in performing surgery that rejuvenates and freshens your look without, the operated-on look. Again, that's one of the problems that a lot of patients come in saying, look, I don't want to look like I've been operated on. And absolutely, with both of these operations, the eyelid surgery and the facelifts, there are at times where people come in and say, I really don't like the photos in the popular magazines, but really, if you have a good eyelid blepharoplasty or facelift, you should not look like you've had an operation. So basically, it freshens you up, but nobody should know that you've had the surgery. So in terms of where I practice, my main rooms are in Mossman, but I also go on to the Upper North Shore at Wahroonga and also travel up to Gosford most Mondays. But as I said, my main rooms are in Mossman. I'm there 3 days a week. So blepharoplasty or eyelid surgery, I'll just spend 5 minutes talking about each of the two main procedures, and then we'll get on to some of the questions that people have put in, because there are already about 15 questions that people have asked. So eyelid surgery or blepharoplasty, that's one of the commonest, the 5 commonest plastic surgery operations. It's by far the commonest facial surgery that people test the waters. So people have eyelid surgery anytime from in their mid-30s to when they're 80. So people can have surgery on both the upper and lower eyelid surgery, but probably the upper eyelid surgery is sort of 9 or 10 times more common than the lower eyelid surgery. So the upper eyelid surgery is really a relatively simple procedure. It can be performed under local anaesthetic in the office, so you don't need to go to hospital. A lot of patients, if they have a lot of loose skin, it starts affecting their vision. And so there is actually a Medicare item number for a lot of patients who have upper eyelid blepharoplasty. So in order to get that, you need to go to your optometrist and have a special test showing that it's affecting your vision. But if they say it is, then there is actually a Medicare item number, which you'll get $500 or $600 back from Medicare for the surgery. And as I said, because it can be performed under local anaesthetic in the office, it's a relatively inexpensive procedure. Lower eyelid surgery is a little bit more complicated, and if it's just loose skin, then you can actually take some loose skin out under local anaesthetic in the office. But if it's bulging fat or eye bags that people commonly refer to, then in order to remove them, you need to have an anaesthetic in hospital. That does have increased expense. So both of these operations, most people are back to work within a week or at most 10 days. So everyone gets a little bit of bruising and swelling, and you need to rest and take things quietly for a few days, not run around and ice everything. Upper eyelid surgery sutures normally come out at 5 days, and then most people are back to work by 7 days. The lower eyelid surgery, the recovery is a little bit longer, but still most people are back to work in 10 days with the lower eyelid surgery, even if it's the more complicated surgery that involves going into hospital. In terms of cost, again, that was one of the things that people asked about beforehand. The cost of upper eyelid surgery, if you've got a Medicare item number, is about $3,000. It's more like $4,000 if you don't qualify for the Medicare item number. And then if you have a lower eyelid surgery in hospital, that's about $6,000 or $7,000, depending upon what's required. So in terms of facelifts, again, there are lots of different types of facelifts, but most of the facelifts that I perform are a full, what's called a SMAS or deep plane or facial muscle facelifts. So there are a few other variants like what are called mini facelifts, where you just take out the skin, but most people that I see actually prefer to have a proper big operation that involves a 3-hour anaesthetic in hospital. So the mini facelifts, again, some people come in and say, look, I've only got 10 days off work and I really can't, don't want to have a general anaesthetic. Then yes, you can freshen you up just under local anaesthetic, performing a mini facelift. That's about half the expense. But most people with a mini facelift, the skin tightening only, it only lasts somewhere in the order of 3 or 4 years. Whereas a full muscle tightening facelift, often lasts a good 10 plus years. So the original facelifts that were performed in the 70s and early 80s, they were all skin-only facelifts, and there were a couple of main problems with those. One is that people got all of the tension was taken on the skin, and so you tended to have stretched and problem scars. And one of the other problems is because it's only putting all the tension on the skin tends to stretch and you get more loose skin a short period of time afterwards. So look, somebody's just popped a question up there. How old do you have to have a facelift? So look, at 33, the question is, can you have a facelift at 33? So very few people have enough loose skin to warrant a proper facelift at 33. I have actually performed facelifts on people in their 30s, but it's unusual to have enough loose skin to warrant it at that stage. Most people who have facelifts are in their 40s to 60s. Again, are you too old to have a facelift when you're 80? Well, no, if you're fit and healthy. So the advantage of a full facelift or a muscle tightening facelift, which were developed 30 years ago in the 80s, is that it gives a much more long-lasting result. So as I said, it's a 10-year plus result compared to a 3 to 4 year result. Because most of the tension's taken off by putting the tension on the deeper layers and not on the skin, you get much better scars. Very few problems these days with facelift scars. So in terms of the mini operations, as I said, some people do still have them, but it's a minority. Most people with a full facelift, it's a 3-hour operation, general anaesthetic in hospital. Most people go home the next day, and if you're lucky, you can be back at work at 10 days, but really you need to allow 2 to 3 weeks off after a full muscle tightening facelift. So the mini facelifts, as I said, some people can get back to work, by 10 days or even 7 days if you're lucky, but you need longer than that with a proper facelift. So in terms of the young people with just a little bit of skin laxity, I think there are much better options rather than mini facelifts and having surgery these days in terms of skin tightening laser. So laser technology has really improved quite a lot over the last 10 to 15 years, and there are 2 or 3 really good skin tightening lasers which I think give a equal result to a mini facelift but without surgery and at a fraction of the cost. So in terms of the cost, the skin tightening laser, 3 treatments with the skin tightening laser costs about $3,000. A mini facelift costs about $9,000, and a full facelift, starts at about $17,000. So if you're not, just have a tiny little bit of skin laxity, as I said, skin tightening lasers are really good these days. There's really no downtime with those. And there's simple office treatments that you can go back to work the next day. There's no downtime. And the studies show that 11 out of 12 patients get visible improvement with skin tightening lasers. And it's a good way of delaying the aging process if you're not quite at that stage where you've got enough skin to warrant a facelift. So a lot of people, a lot of the Hollywood stars these days have skin tightening lasers like Thermage and Skin Tight, Ultraformer every 6 months. And basically the lasers work by stimulating collagen in the lower part of the skin. As you age, you lose collagen and elastin fibers, and so these lasers stimulate that and, provides more collagen, tightens things up, and takes away a little bit of that aging process. If you have an inch or two of loose skin, then really you need to have a proper operation rather than the skin tightening lasers. But if you're 30 and just have a small amount of skin laxity, then those lasers are good options. So in terms of the proper facelift, as I said, that the muscle tightening facelifts are what most plastic surgeons perform these days, and that gives most patients a good 10 to 15 year result after the surgery. So I'm just going to now go on to read out some of the questions that were put in through the website beforehand. So the first question is, I have really dark circles under my eyes, which seems that nothing can help with. Do you think a blepharoplasty would be good for you? So look, dark circles under the eyes usually means that you've got some bulging fat sitting on top of the eyes, and people's attention are actually drawn to the shadow, the dark line, rather than the actual fat above it. So if you have dark circles, then unfortunately there are really no good non-surgical options for them. You can have some dermal fillers in that area just to give you a little bit of disguising at the early stage. But once you have advanced deep circles, then you really need an operation, and lower blepharoplasty will give you a good improvement in that appearance. So what it does is the lower blepharoplasty takes away that bulging fat and flattens it out, and actually tightens up the skin. And you can just, if you just do that to yourself, if you're worried about your dark circles at home, just pulling your eyelid skin like that gives you the result that you would get from a lower blepharoplasty. So as I said, the lower eyelid surgery, if you're removing fat, is a little bit more involved and does need a general anaesthetic in hospital. So look, the second question again was about the fat pads, and I've answered that a little bit, but it's a more involved question. It's a very good question, the third question. So it says, I know as you get older, you lose fat in your face. So would that make my eyes hollow if I have a lower blepharoplasty? So they just say that this person says that they don't know what to do, but they just hate the fatty bulges in their lower eyelids. So look, it is true, as you get older, you do lose some fat, both from the cheeks and actually from the eyelids. So the key so it's a trade-off. So the more fat you remove with a lower blepharoplasty, the better the improvement you get in the lower eyelid appearance at the time. But if you are unlucky and lose a lot of fat as you get older, it is true that you will get some hollowing in that area where you've got some bulging at the time. So look, it's a difficult trade-off, and again, that's an individual decision. So when people come in and we talk about, removing the fat, that's one of the questions I ask people about, and it's a question of whether or not they think that's going to bother them. So if they're really worried and want it as flat, as smooth as possible, then you have to remove as much fat as possible, and that means that you're at more risk for getting hollowing later. If you remove less fat, you get less improvement with the surgery, but it means that you don't have that risk. So most people, when I talk about these options with them, would prefer a greater improvement now, and then potentially worry about hollowing in 15 or 20 years' time. So the next question is, what can go wrong with the blepharoplasty? So in terms of the risks and complications, so most of these operations go absolutely without a problem. So the face has a very good blood supply. It's very unusual to have infection or healing problems with things on the face. So basically what patients can expect after the surgery is a little bit of bruising and swelling. In fact, everyone gets bruising and swelling. That's just part of the surgery. A lot of people get a little bit of temporary irritation in terms of dryness or wateriness of the eyes afterwards. So the main gland that produces tears is just in the eye socket, just underneath this part of the eyelid. And obviously we don't do anything with that with the surgery, but often with the swelling after the surgery, that doesn't function normally. And so a lot of people either get too many tears or too few tears. So it's very common to be a little bit watery or have a little bit of dry eye for a week or two and need to use some liquid tears after the surgery. In terms of other things that can go wrong with the upper eyelid, it is rare to have problems. So occasionally you can get a little cyst or problem with a thick scar. Again, thick scars are very unusual on the face. Some areas of the body, like the upper chest, upper back, where it's common, but usually most of these scars are hidden in the creases and are really just like a fine white line that you have to look hard to see later. In terms of complications on the lower eyelids, again, there's another question later on saying that they saw a lady who had too much skin removed and she couldn't close her eyes. Well, really, that is rare. I can honestly say I've been a plastic surgeon for 20 years and that has never happened with one of my patients. Basically, that is partly experience and partly, knowing what to do. And, I perform a lot of blepharoplasties. I perform at least one upper eyelid surgery a week. And as I said, I've been a plastic surgeon for 20 years. I've never seen that problem. Really, that's from just taking out way too much skin, and really, if you see a well-qualified plastic surgeon, they should not be doing that to you. So in terms of the lower eyelids, there are some more complicated and rare things that can happen with the eyelids in terms of the scarring, pulling the eyelids down. And some, rare problems in terms of bleeding or things after the surgery, but they are rare. The lower eyelid surgery, probably 1 in 50 people get a problem with the scar, thickening up or pulling it down a little bit. So again, that does happen, but it's really rare. Major healing problems, as I said, are really exceptionally rare with the eyelid surgery. So the next couple of questions were really about can it be done in the office and downtime. I think I've answered those. So just to go through that again, the upper eyelid surgery can nearly always be performed under local anaesthetic in the office. 80 or 90% of the upper eyelid procedures I do under local anaesthetic in the office. The lower eyelid surgery is different. If it's just loose skin, you can perform that under the office. Under local in the office, but if it's bulging fat, then that needs anaesthetic in hospital. Okay, so the next question was about the Medicare item number. So I'll just go through that again. With the lower eyelids, there are no Medicare item numbers. It is deemed cosmetic. The upper eyelid surgery does qualify for an item number if you have enough loose skin to push down on your eyelids and actually be obscuring your vision. So in order to gain access to that Medicare item number, you need to go to an optometrist. If I see a patient who I think is going to qualify, I actually give them a referral to an optometrist, and they do some visual field assessments. So what they do is they look at your visual fields and the amount that you can see just at rest, and then they actually tape the eyelid skin out of the way, up onto your brow, and then if you can actually see more in that situation, then you qualify for a Medicare item number, and then as I said, Medicare will pay you $500 or $600 towards the procedure. And then also, if there is a Medicare item number and you're insured, then that means that your fund would normally pay for the bed and theatre fee, the hospital costs with the procedure. So in terms of, so the next question is somebody saying that he doesn't know, want anyone to know, if they go ahead with an eyelid procedure, that they've had anything done. So look, I can assure you that both of these procedures, very few people work out what has been done. So most people will say, if you come back after a week from the office, say that you look well or refreshed, but very few people can work out, what have been done in both in terms of the eyelids and the facelift procedure. So basically, if you look strange, you should, it hasn't been done properly, and no qualified plastic surgeon is going to do that to you. Even in early stage, these scars on the upper eyelids are really, they're hidden in the crease. A little bit of makeup can disguise them. And long term, there's just a tiny little crease you can see out here, which just looks like one of the normal little creases there. So if you just have a blepharoplasty, you will not look different or strange. I can promise you that. So we'll just go on to some questions with the facelifts now, and people, again, this comes back to what we were talking about originally with the facelifts. So I've heard there are a few different types of facelifts. Can you tell us what they are and when you do one over the other? So basically, as you get older, obviously the loose skin increases, and what is right for you depends upon, an individual wishes. Obviously, some people come in and say, look, I want the maximum improvement. I want to be the best I can. Well, you just need to have an operation. Some people come in and say, I'm really not ready for surgery. I'm very nervous. What can you do for me? And there are non-surgical options in that situation. So basically, if you just have a little bit of loose skin, if you're in your mid-30s, very few people have enough skin laxity to warrant surgery. So with all of surgery, there is a risk-benefit ratio. So if you have a lot of skin, you're going to have a big difference after the surgery, and you get a good benefit. And so for most people, that's worthwhile. If you've just got a tiny little bit of loose skin, then you need to think more seriously about whether it's the right time for an operation for you. So when I'm talking about loose skin, to give you some idea, so most people who have skin only or mini facelifts might only have a centimetre of skin on each side. With a full facelift, it's not uncommon to take out 2 or 3 centimetres of loose skin on each side. So that's, if you pull the skin back like that, that means if you've got 2 or 3 centimetres of skin on each side, that's actually, 4, 5, 6 centimetres of loose skin that you're taking out. So In terms of the result that you get from a facelift, I didn't talk about that. If you just pull your skin back like that along the jawline, then that is the result that you get from a facelift. So if you just compare it, just put your fingers on the jawline, pull it back along the jawline, then you can clearly see that difference in there, and that is basically what a proper facelift will give you. Okay, so look, somebody's just popped up with a question. So if I have excess skin from losing weight, can I get an item number for the facelift? So unfortunately not at present. There is no, there are exceptional circumstances which have item numbers for facelifts, but they're after major accidents or things like if you have a stroke or facial palsy, Bell's palsy, something like that. Unfortunately, there are lots of areas of the body, such as arms, thighs, tummy, where if you lose 20 or 30 or 50 kilos, which is really very common these days, where there are item numbers which will help, pay for the surgery. But unfortunately, with a facelift, there are no item numbers, even if you, achieve that sort of massive weight loss that's relatively common these days. So I didn't talk about the scars. So in terms of a facelift, as I said, the eyelids, the scars are just runs in the crease. You can't normally see them. I'll just show you in terms of the facelift scar, it just runs right in the crease just in front of the ear, underneath the earlobe and back into the hairline. So really the most obvious bit of the scar is just behind here between the ear and the hairline. And so if you're considering having the operation, you need to make sure that your hair isn't very short, because it really does help disguise the scars in the first 6 or 8 weeks if you've got some hair to cover everything up. Really, as I said, in terms of these scars, it's exactly the same as the eyelids. In terms of complications are really uncommon with facelifts. Again, it's the same thing as a good blood supply. It's really unusual to have infection or healing problems. It's unusual to have scars. Occasionally, you can have a problem with a thick or lumpy scar behind the ear, but the scar in front of the face, in front of the ear, really most of those, even at a few weeks, you have to look hard to see. If there's a lot of skin laxity, there's actually an incision underneath the chin and the neck, which we use to tighten the muscle layer in the neck for proper full facelifts. But again, nobody really looks at you from underneath, so that's really not visible at an early stage. So to get back to the question of when are different facelifts useful, so very minimal, 1 centimetre amount of loose skin, really you should be looking at skin tightening laser. If you're in a 1 to 2 centimetres of loose skin on each side, that's the type of thing that you can get rid of with a mini facelift. Once you're starting to get to 2 centimetres or more of loose skin on both sides, really you need to have a full muscle tightening facelift to get a really good long-term result. So again, the next question is about the SMAS facelifts. Just to quickly reiterate, the SMAS is the muscular supporting layer in the face, and most plastic surgeons do proper SMAS or muscle tightening facelifts these days. The advantages of that, it is a bit more involved. It's a slightly longer operation, but you get a much better long-lasting result. You get much fewer problems with scars, stretch scars, problem scars, and really the main benefit is a much better result with fewer complications. So in terms of different types of facelifts, there's a question from a patient which is very specific about, it says, I've seen Dr. Cow in the US does a ponytail facelift. Do you know anybody in Australia who does those? So look, the ponytail facelift, there are 2 variants. One is for the upper part of the face, so it's like a lateral brow lift, and affects mainly the upper part of the face, and the other one is a full facelift. So these are mini facelifts, and again, they're very good for early, skin laxity where you've got a small amount of loose skin. They're really not appropriate for patients with a couple of centimetres of loose skin on each side of the face because, number one, it won't get rid of the problem. If you have 2 centimetres of loose skin, then you need to take the skin out. If you have, the ponytail facelift just involves mini incisions up here in the hairline, and if you've got a lot of loose skin, then you simply can't get rid of that loose skin. So it's appropriate for people with early facelifts, the mini type of lifts, but not appropriate for people with a lot of loose skin. So in terms of, I don't actually know anybody who does a ponytail lift. I have heard of them. It's a type of mini facelift. I perform, other variants of mini facelifts, but in terms of whether anybody does that in Australia, unfortunately, you'd have to Google that to see whether or not you can find somebody. But as long as you realise it is a mini facelift, it's not a full muscle tightening facelift. Right. So the next question is again, there was another question about Medicare item numbers. I think I've answered that. And look, somebody's just popped up with a question about eyelid surgery. It says, can you get a blepharoplasty and then continue to wear contact lenses? So absolutely is the answer to that. So look, really in the first few days when you have some swelling and irritation, you're not going to be putting contact lenses in at that stage, but later on in the week. So usually with all facial surgery, the bruising and swelling is worse on about the second day. Usually by the third day, it's starting to go down. So usually by day 5, when people are starting to get around, and some people, if they're lucky with upper eyelid surgery, can go back to work at day 5. You can go back to wearing contact lenses at that stage without a problem. Right, so somebody's again asking questions about prices for facelifts. So just to go through that, so the mini facelifts, the skin-only facelifts that can be performed under local anaesthetic. Just to go through the prices and recovery again, they cost normally about $8,000 or $9,000. The mini facelifts take about 2 hours under local anaesthetic in the office. You can go home immediately. Most people have, you need to wear a facial compression garment. I'll just show you one of those garments. So here's just to show you a facial compression garment. It's got a couple of Velcro straps, so it's very easy to use and to put on and off. You need to have that on for a week after the facelift surgery. So the mini facelifts, the sutures come out at 5 days. And a lot of people are back to, getting around at a week. You might still have some bruising at that stage, but certainly by 10 days, most people are back to work. Again, it's one of these things that you can, if you've only got 10 days or a week that you can take off surgery, then most people can get away with having a mini facelift and being back to work, taking 6 or 7 days off work. But again, you've got to realise that the long-term result is not as good as a proper muscle tightening facelift, and most people, the mini facelifts, only last 3 to 4 years. So in terms of a full muscle tightening facelift, that's a 3-hour operation under general anaesthetic in hospital. Most people stay in hospital overnight after that sort of length of general anaesthetic. And the cost is more like about $17,000. All right, so it's double the price of a mini facelift, but it gives you a much longer result. So in terms of value for money, if you think of a mini facelift that might only last 3 years, costs $9,000. For double that, $17,000, you get an operation that lasts 3 times the length, or sometimes even more if people are lucky. So look, that's all of the questions that people have sent through. I don't know if other people want to ask questions now. I'd be more than happy to continue answering them. So just to go through the main points of this surgery. So eyelid surgery is by far the most common facial surgery that people test the waters with. As I said, I do at least one upper eyelid surgery a week, and facelifts are still quite common. I do, most of the facelifts I do are proper muscle tightening facelifts, because I believe they give you by far the best long-term result. And even though they're a bit more involved, they have fewer complications, less long-term problems than the skin-only facelifts. So in terms of this sort of surgery, just to reiterate, you should not look strange after either eyelid surgery or a facelift surgery. So basically it takes away the loose skin, it takes away if you've got bulging fat on the lower eyelids, it freshens you up. People should be saying when you go back to work that you look great, that you look fresh, you look relaxed. You should not be able to tell that you've had anything done. Really, people come in a lot these days with photos out of magazines saying, I don't want to look like this, and I can promise you that you simply just look fresh after this sort of surgery. I've actually had 2 patients already come back from facelifts in the first couple of weeks of this year, who both commented that people have said they look really well, but they haven't been able to work out what they've had done. I had one patient actually today who came back and said they'd had somebody who said, have you had fillers or what have you had? You're looking really well. And she actually admitted that she'd had a facelift, but the person couldn't tell that they'd had a facelift 4 weeks after their operation. So look, somebody else has just asked another question. Can you have another facelift in 10 years when the first one runs out? So absolutely is the answer to that. So I've been around long enough now. As I said, I've been a plastic surgeon for 20 years. I'm starting to occasionally see people back for their second facelifts. One of the first patients that I actually did a facelift on when I started practice, it was actually their second facelift. So they'd had a facelift 12 years before the first. I did their second facelift operation, and they've actually come back and had a third facelift. And again, my first facelift operation, which was their second one, actually lasted 13 years. So that's the type of length of time that a proper operation, proper muscle tightening facelift should last. So it is unusual for people to have more than 3 of these operations. So this patient I'm talking about that I did their third facelift last year, she's in her mid-70s now, and so I think it's unlikely that she'll probably want another one. So just while we're talking about that, in terms of the upper eyelid surgery is definitely an operation that a lot of people have twice. Again, it depends on how people age, but if people have their first upper eyelid surgery in their 40s, and you're looking at a 10 to 15 year length of time for the operation to last, then it's perfectly reasonable to, for people to be expecting to have a second one or even occasionally a third one. So it's just like the facelifts. So again, it depends on the individual person. It depends on how they age, but having these operations, the way to look at it is that it's taking away the loose skin and the problem that's there, and you're doing what you want to do now, but you will continue to age. It doesn't stop the aging process, and it is likely in 10 or 15 years that you will have some more loose skin. and then it's just a question of is that bothering you enough to have the surgery? So look, a patient's just asked, do you just do a neck lift? What's the difference? So look, it depends. Again, so neck lift alone is an unusual operation, but some people do have it. So it depends on how you age. So most people these days have what's called a lower face and neck lift combination. And when I was talking about the prices of generic facelift, that's the combination that I was talking about. So we divide the face into the upper part of the face, the middle part of the face, and the lower part of the face, and then the neck. So although some people develop skin laxity just in the neck and not on the jawline, that's unusual. So most people who have enough loose skin in the neck to warrant a surgery also have some skin laxity over here on the jawline. And so basically we do an operation that changes from the middle part of the face down. So it's one of those things that if you just tighten the neck and you've still got, so this is completely, all the loose skin here is completely gone and you've still got loose skin over the jawline, then that looks a bit strange. Again, it's the same thing if you just tighten here and you've got then loose skin in the neck, then that looks strange. So really to blend things in, you need to do from the middle part of the face, the lower face and neck all together. So occasionally people age differently where they just have loose skin on the neck, and occasionally in that situation we do what's called a neck lift or just tighten the muscle here, often do a little bit of liposuction, take out a little bit of loose skin, but that's unusual. Most people need a lower face and neck lift. Again, mid-face lifts, which used to be very common 20, 25 years ago when I trained, they're almost completely disappeared these days. So the reason why they've disappeared is because of cheek filler, dermal filler, and fat transfer. So the changes in the middle part of the face as you get older, we've already mentioned that you do lose some fat from the middle part of your face, and so you lose support here, and that means that because of that, this cheek tends to drop down a little bit. You get this fold forming, and this fat here, which used to be up higher on the cheek. So 20, 25 years ago, people used to have cheek implants or mid-face lifts to give you more volume in the cheek. Dermal fillers started being used to restore volume in this part of the cheek probably 10 or 15 years ago, and really that's very common these days. The original indications for fillers were for lips and for the nasolabial folds, this depth of fold here. Now really the most common indication is actually cheek volumization, restoring that. So cheek volumization with temporary dermal fillers, they use hyaluronic acid, which is the normal filling substance in your skin. It's a very simple procedure. It takes 20 or 30 minutes. You get an instant result, and most people it lasts 12 to 18 months. For people who regularly have cheek filler, if they're having an operation, you can actually use your own fat to restore the volume. And certainly if people have facelifts these days, probably half the facelifts I do involve injecting some fat into the cheek to restore volume. And that alone, just putting volume back in here, will make you look younger. It lifts the cheek up in that direction, so it decreases the depth of this the fold here, and gives you more volume here and makes you look younger. So some people have fat transfer by itself to give you cheek volumization, but the majority of people that we do it on is as a part of a facelift at this stage. So are there any other questions that people want to send through? Are there any other things that people want to ask at this stage? Okay, well, look, thanks for joining. There has been quite a lot of interest. I think there were about 15 questions that were sent through, and we've had some more this evening. So probably 20 questions in all. I'm hoping that this has given you some of your answers. Basically, there's a whole lot of information. So if you just go to drcharlescope.com.au, there's a whole lot more information on these common surgery there. If you have any other questions, shoot me an email. Again, there are lots of links. You can send a question through the live chat on the website, or shoot an email through, and we'll get back to you. We answer our emails within a few hours of coming in. So, okay, I'd like to thank Trish again for this opportunity to speak to everyone. And as I said, I hope you found it informative. Thank you.